On this episode, we visit the Pedestrian Bicycle Information Center in Chapel Hill, North Carolina. Then we talk with the Urban Land Institute about smart growth at a meeting in Atlanta, Georgia. We get 3 perspectives on a neighborhood near the Kentucky School for the Blind in Louisville. Finally, we go to the Centers for Disease Control in Atlanta to learn about the importance of physical activity and walking. Stay tuned. We're in Chapel Hill, North Carolina at the University of North Carolina, a Highway Safety Research Center, talking with Charlie Zagier, who's the Associate Director. What is the Highway Safety Research Center?
Well, it's a part of the University of North Carolina. We've been in existence since 1965, and our mission is basically to conduct research, conduct training, and work with the community, the state, the nation in terms of promoting highway safety. We get involved with all kinds of areas, including trying to engineer safer roadways, trying to educate the public, the drivers, pedestrians, bicyclists, etc., and also enforcement issues. So kind of the wide range of areas related to safety.
One of your activities currently is called the PBIC. What does that stand for?
It stands for the Pedestrian and Bicycle Information Center.
What is that?
Okay. Well, it's a program of the U.S. Department of Transportation. It's overseen by the Federal Highway Administration. John Fagan is the contract manager. But it's really an effort to try to coordinate training and education, disseminating information to professionals, to the public, to advocates, planners, engineers, dealing with pretty much any issues that affect walking and bicycling.
You must have a website. What's on your website?
Correct. Well, the website is really intended for almost any audience, anyone from someone in school that's writing a term paper on bicycle safety, or walking to school, or how to get across the street safely. Just about any topic, health related to walking and bicycling, to the professional that's really looking for some specific design issues, or what countermeasures can best reduce crashes involving walking and bicycling. So it really covers the gamut, the wide range of walking and bicycling topics, meant for pretty much anyone interested in that.
We're in Atlanta, Georgia, talking with Michael Pavlukevich with the Urban Land Institute. What is the Urban Land Institute?
We are a research and education organization based in Washington, D.C. We have about 16,000 members in the development industry, financial people, developers, public officials, but our role is to bring together all the information about how development is done in the best way and disseminate it in the industry. So you see behind you here our bookstore, where we publish all kinds of books on different subjects, not only smart growth, but resort development, golf course development, transit-oriented development, all kinds of books about financing development, how to do development, residential, shopping center development, all those kind of things. So we do the research and we disseminate the information.
And speaking of smart growth, we're having your 4th annual Smart Growth Conference here this week. What is smart growth?
I thought by now everybody knew what smart growth was, and that's one of the things that I've really been pleased over the past 4 years to see smart growth start from what is smart growth? That sounds like some cute little term that everybody's going to smile about, to come to a place 4 years later where I think there's a real understanding that smart growth, the opposite of smart growth, is not, like some people like to say, dumb growth. It's mindless growth. It's where development just occurs, just leaps out to the cheapest land, or shopping centers just spew out across the commercially zoned land along a highway, and you have all these places that are spread out. This is when I'm defining sprawl right now. Things are spread out all over, and you have to get it every time you want to do any one thing. You got to get in your car and go to that place to do a thing, then get back in your car and go to another place to do another thing. Smart growth is trying to take our communities and bring them back together in a more compact format, less dependence on automobile and more transportation choices, so that you might be able to use public transportation as well as your car. Use your feet. Walking is a very important transportation option. Use bicycles, but also build communities. So we actually, I guess the global definition, and I want to say global because smart growth means different things in different places. That's because we have different communities with different cultures and different business techniques and what have you. So what the details are mean different things in different places. But globally, we like to say that smart growth is growth. Growth is going to happen. We know it's coming. People are having babies. We have immigrants coming to this country. We have to manage the growth, but we have to do it in a way that's good for the environment, that makes economic sense, and that's good for the community. So that's the idea. Think of that like a holistic ball that we have. As this growth occurs, it has to meet all these three objectives: to be good for the environment, good for the economy, and good for the community.
We're in Louisville, Kentucky, talking with Cassandra Cullen. What's this neighborhood we're in?
The Clifton neighborhood.
How does planning work in Kentucky? How would neighborhood planning take place in Clifton?
Clifton is in Louisville, Kentucky, a neighborhood in Louisville, Kentucky, and the city of Louisville has a planning process which involves neighborhoods developing long-range plans for how they would like to, what direction they'd like to see their neighborhood going for the next about 10 years. And our neighborhood is in the process and the later stages of developing a plan for our vision of our neighborhood.
What sort of issues have you been looking at this time around?
Last time there was a focus on zoning issues and having the neighborhood zone more consistently with the way it's being currently used. This time around the issues are transportation issues, and I am particularly interested in pedestrian issues. We had a working group to specifically deal with pedestrian and bicycle issues. We also are very interested as a neighborhood in public transportation, reducing the number of cars on our streets, and making the neighborhood more friendly to pedestrians is my particular interest.
And as part of that interest, you're now chair of a committee. What's the committee?
Growing out of this planning process, and partly as recommended in the planning process, a pedestrian and bicycle access committee was formed within our local Clifton Community Council to address these issues.
What has the committee had a chance to look at so far? What are the big issues?
There are a number of issues. One big issue is sidewalks, obstructions and hazards on sidewalks, as well as putting sidewalks in places that there are no sidewalks, and making the sidewalks more usable for all pedestrians, including people who are blind and visually disabled, as well as pedestrians in wheelchairs. But the Kentucky School for the Blind is in our neighborhood, as well as the Printing House for the Blind, which is a national organization, and the Industries for the Blind. We have one of the largest communities of blind people in the country here in our neighborhood, and so our council is very concerned about our neighborhood being accessible to people with visual disabilities and blindness.
And certainly obstructions in the sidewalk are going to be a problem for all pedestrians, including blind pedestrians. How do you approach a problem like that? Who's in charge?
Well, as I said, we have a neighborhood plan that's in the final stages of development. We have this committee, and in fact, in October, our regular meeting of our committee will be a forum on sidewalk obstructions and hazards. And we're inviting the Department of Inspections, Permits, and Licenses, Public Works Department, and the Police Department to come and talk about what recourse people have when when the sidewalk is being blocked, whether it's by cars or by street furniture or whatever it might be, and how to deal with hazards. We'd also like to see, as a neighborhood, developing some kind of process where people could call the neighborhood association with a concern about a sidewalk obstruction, and a friendly reminder could be made to residents about what their responsibilities are.
We're in Louisville talking with Kathy Signier. Behind us, the sidewalk ends into one big parking lot. What problems does that present for you?
A lot of confusion, mostly. What a lot of blind folks will do, if you're a blind pedestrian anyway, and if you have a sense of hearing, you can often listen to your traffic and use it as a wonderful audio cue to help you know if you're walking straight across the driveways and the parking lots and the sidewalks. And often that works fairly well. But often there are a lot of quiet times when you still need to get somewhere. And it's very easy, I think, even if your mobility skills are very good, to get quite lost and quite confused. Many people in the blind community have, whether they use a cane or a guide dog, will complain that they have found themselves in the middle of Frankfurt Avenue. This is the street behind you. And it's just very dangerous, obviously, to find yourself suddenly in a busy street. And I think this is a problem all over the country, that there are lots of cars. I mean, the world is built for cars right now, at least in the U.S., where there are lots of parking lots and lots of driveways that really do confuse people. The other problem with lots of driveways and parking lots and nothing to delineate those from the sidewalks is that it gets very difficult to find buildings. We've spent a lot of, when you're in a city, which is wonderful, you're usually walking right along the building line as a pedestrian, and you can find buildings easily. When you're not, you often have to walk across these vast parking lots to maybe find a building or maybe not. And that is also really quite frustrating, and you end up wasting an awful lot of time. I think as blind people get more and more mobile, using their feet especially, we're going to be finding ourselves in lots more unfamiliar places, and we don't always have a nice, friendly person to train us to get to every location we want to. And so we need to have a better way to take a lot of the guesswork out of getting to point A to point B in an efficient way.
We're in Louisville talking with Chris Hughes. Right behind us, Frankfurt crosses a set of railroad tracks. What sort of problems does that present for you?
Frankfurt doesn't cross the railroad track. The railroad tracks run parallel to Frankfurt at the point where we are at right now, where we walk across them. In this neighborhood, you have to cross those tracks pretty much to get to anything that, to get from one side of Frankfurt to the other. Or not one side of Frankfurt, but one part of the neighborhood to the other. And at the point where they're problematic, they run pretty much parallel. And it's a very open area all around the tracks. So there's really no good landmarks or no good delineation between where the streets is, the railroad tracks, where there's the sidewalk or anything like that. And because there are a couple of different streets back there, that angle, there's a street called Weichel that's back off there too that does something strange. If you walk up there with a dog or a cane, but I can speak to the dog issue best. The dog is going to, first of all, is going to angle out toward the street and the railroad tracks running parallel, and most likely is just going to keep walking with the tracks because they run the same direction as the street. Another thing the dog might do is turn to try to cross the tracks and put the tracks straight in front, because that's how you usually cross railroad tracks, that's straight in front. And that would be a bad angle at that point to cross them.
How would you go about trying to solve a problem like this?
Well, the city did put a sidewalk that would lead to an alternative method for crossing the tracks. And in part, there's been some effort and some communication about that, because there is the beginnings of having an alternative. The problem is there's not a real clear way to get from the end of the sidewalk they put in to the walkway that actually goes straight across the tracks. There's still some problems with what we need are some good landmarks. What we need is a system for dogs that they'll see, that they'll know to follow. We've been thinking about further looking at the situation with a trainer from a guide dog school or two to get some input on what system might work well for a dog, something that would look appealing for the dog to follow so that it would be clear what route to take to get safely across the tracks.
How do the issues differ for a dog user versus a cane user?
Well, with the cane user, you can use different kinds of landmarks. You can use textures under your feet or under the cane. You can use bumps, curb a lot. They can use speed bumps. You can use a lot of landmarks that the dog are going to see as obstacles and lead you around them. I used to live in a place where they would put big globs of cement as markers on the sidewalk along the campus where I lived, the university, and that was great for cane users because you're going to hit them. For dogs, they're going to say, ooh, obstacle, bad thing, and they're going to just breeze right on by them. So you have to come up with landmarks that the dog is going to see, and landmarks that you can know about that are different that you can show to your dog.
We're in Atlanta, Georgia, talking with David Buckner, who's chief of the Physical Activity and Health Branch of the Centers for Disease Control and Prevention. What does your branch do?
Well, my branch is primarily concerned with promoting physical activity in Americans. Physical activity is a large public health problem. Unhealthy eating and physical inactivity combined is probably the number 2 health problem facing this country. It counts for maybe 300,000 deaths a year. It contributes to a variety of chronic diseases, perhaps causes 30% of heart disease, and contributes to other problems like osteoporosis and falls in older adults, and even probably depression. So it has a lot of health effects if you're not physically active, and so we're working on strategies by which Americans can enjoy their health more and enjoy active lifestyles.
What would some of those strategies be?
Well, most recently we've been working on strategies that relate to environmental determinants of physical activity. There's not a lot known yet about this, but I think it's pretty obvious that it's logical that you do need some place to be physically active. Sometimes that's inside in a fitness club or facility, but a lot of the times you want to be active outdoors. And so you need an environment outdoors that is not only allows you to be active, but ideally it would even promote it. It would encourage you to be physically active. And so the way we design our environments logically would have something to do with how physically active we are. A common example that we experience now is that maybe 100 years ago, if you were to go into a hotel, you would likely be met by a grand stairway inviting you up to the rooms. Now, and you would be physically active going up that stairway. Now when you go into a hotel, you'd be lucky probably to find the stairway unless you work a little bit. And if you get in the stairway and try to use it to be physically active, you may experience some problems in terms of sometimes the doors lock or you come out at the basement in a funny location that you don't plan on. So in general, we have not been as concerned with designing our environments to make them walkable and pedestrian friendly and promoting physical activity right now. In the past, of course, before we had cars and other modern conveniences, our cities tended to be compact and denser, and they were pretty much walkable. That was a major way that people would get around the city. Now with the urban design we have now, you might have cul-de-sac neighborhoods with a lot of dead ends. Those can be much harder, or at least inefficient, to negotiate for a pedestrian. So once again, it's logical that these type of changes in the way we build our environment and design our communities could be affecting our physical activity levels.
What sort of trends have you seen over the last decade or so? Are people more active, less active, and what's been happening with people's health?
Well, we have some information about what we're doing now in terms of transportation, a little less in terms of history, but we can kind of project that from, I guess, our anecdotes of when we were growing up. If you look at children who live within a mile from school, only about a third of those children actually walk to school, even though it's not very far now. Certainly when I was growing up, I remember basically most of my class walking or riding their bikes to my local grade school. So that's been a big change, I think. At the same time, when I was a teenager, even though I could drive, the shopping center wasn't that far away, and it was less than a mile, and I would just walk. Now, although a fourth of our trips are a mile or less, we take the car for 3/4 of those trips. And if you look at trends over time in this decade, you see that there's been maybe a further increase of 5% in the number of car trips we take, getting us up to maybe 89% of our trips or something like that would be by car. In this respect, we're an outlier as a country. It's not like all countries of the world do this at all. Canadians drive less, and countries in Europe can drive substantially less, like in the Netherlands, where it's so bicycle and pedestrian friendly.
And you mentioned that the situation with children walking a lot less. What do you have going that might help reverse that trend?
Well, there's a couple of approaches. One approach that's been taken by us is that we can do something right now. And the program that we've been working on is called Kids Walk to School. Kids Walk is a version of what I would call a walking school bus, in the sense that if you could gather children on a school bus and take them in the school bus, you could also more or less gather them as you walk through a neighborhood, and with adult supervision they could walk to school. It has been characterized by kickoff events at local schools around the country, and there's even an international website on Kids Walk to School. The idea then is that through the year the children will walk or bike or even skate as often as possible. We just started this program. We're very interested in how much effect it's going to have. We don't know quite yet, but we're evaluating it. The other approach, which is illustrated by the Safe Routes to School legislation that passed in California, is that there may be problems in the infrastructure that you need to somehow, with transportation money in the case of California, work on the routes by which children would walk to school, make them safer or more appropriate for children, or redesign them in some way to help promote walking to school or biking. And obviously then once you can combine those two, you can both work on the infrastructure or work with the existing infrastructure and just promote the activities, say, in the school, and hopefully if you do both, you'd have more children walking to school. The issues are large here in the sense of keeping our children healthy. In the 1970s, about 5% of children were overweight. By the 1990s, that was about 14% of children. So we're seeing a marked increase in the obese and the overweight of children. And we don't totally understand this yet. But once again, when we put programs like Kids Walk into place, it provides an opportunity to begin to understand just what a program like this could do and what role it might have in confronting a problem like this.
So physical activity in general seems to be good for people. How about walking in particular?
Well, walking is the most commonly reported physical activity, especially in older adults. Maybe 50 or 60% of older adults who get the recommended amount of physical activity, which is at least 30 minutes 5 days a week of an activity like brisk walking. will meet this criteria of getting a recommended amount of physical activity by doing walking. And it's low cost, doesn't require special equipment. You can do it in a lot of places. That's probably one of the reasons it's popular as a form of activity. And another thing we know about walking is that older adults do it more than younger adults. So as we age and we watch the baby boomers age, we should expect an increased demand in our communities for places to walk. Another way to look at, though, the importance of walking is that because it's so common, you can look at its health benefits as a separate activity. And just to give you an example of some of the findings, in a study in 1998 in the New England Journal of Medicine, they compared people who walked less than a mile a day to people who walked 2 or more miles a day. And they found over a 12-year period a 50% reduction in mortality in the people who walked 2 or more miles a day. And this was after adjustment for other factors which might affect mortality. So there's good evidence that walking has health benefits and should be encouraged as a healthful form of physical activity.
What about walking in children? Why would walking be important for children?
Well, walking and all forms of activity are important for children. It's obviously their means of getting around too. Older adults and children share the characteristic that not all of them have driver's licenses. And so they need to have opportunities to walk. You might not, with so many opportunities to be active in children, you might not think, well, maybe walking a few miles makes a big difference to a child. It can make a difference, theoretically, certainly, in terms of their tendency to be overweight. You become overweight by generally only a few calories excess eating a day on average. And so by expending a few more calories in a day, such as by walking to school like we talked about, you could have an impact on the tendency of that child to become overweight. It's also an opportunity for fun. I mean, when I walked to school as a child, we did things. It was an active period in some ways socially as well as physically. And so to that extent, I mean, I think we should be promoting activities that our children enjoy.
Visit us on the internet at www.pedestrians.org.